Hi, I'm Dr. Luke Bucci, and welcome to HealthView. So what's HealthView, you might be asking? Well, I guess the best way to describe it is it's a series of short video visits where I'll be discussing health and nutrition issues a lot of us encounter in our daily and, let's face it, pretty hectic lives. That's my area of expertise, and since 1995, I've worked closely with Shift Nutrition to develop products and practices that people like you and I can really use to benefit our busy days and nights. So today, we'll be looking at some easy ways you can change things up a little. And I know you'll feel better if you try some of them. Okay, let's get started. It's April, and that means it's Bone Care Month. And what I want to talk to you about now are the most important nutrients for your bones. And yep, you guessed it, that does mean calcium. But there's more than calcium, and in the last year alone, vitamin D has gained prominence for bone health, so I'll tell you a little bit more about that. Also, do not want to forget about magnesium, what I call the forgotten mineral for bone health. And of course, Schiff has products that supply calcium, magnesium, and vitamin D to support bone health. Calcium is important for bone health. I think everybody knows that. The problem is that you need more than just calcium alone. But first, let's try to make sure that we're all getting enough calcium. Now, ideally, one should be getting calcium from the diet, and that means dairy products, preferably low-fat or non-fat dairy products. That'll give you a good calcium source from your diet so that you can help your bones stay healthy and strong. Other dietary sources of calcium are a little harder to find. You have to eat a pretty good amount of green leafy vegetables. You also have to eat things like canned salmon, which has those little bones in it, or canned sardines or herrings. Those little bones in there are obviously rich in calcium. Now, our cavemen ancestors used to literally gnaw on bones or actually eat the smaller ones, and we don't do that anymore. That's why we have a high calcium need, but are having a hard time getting it out of the diet if you don't have a high dairy intake. And that's where supplements come into play. The nice thing about dietary supplements of calcium is that they have been researched for many, many years to find out their impact on bone health. And the good news is that yes, calcium does impact bone health beneficially. It's never too late to start taking calcium, and it's never too early either. You're building bone mass constantly. You're remodeling your bone constantly. Bone is not just rock or a hard skeleton that's made up of minerals. Yes, it has minerals, but it is a living, dynamic tissue. Remember, your skeleton, your bones, they get 25% of the blood from every heartbeat. That's as much as your brain. So that tells you that the skeleton is a living tissue. It's constantly metabolically active. And why? Because it's responding to your daily physical stresses. It's making sure that your skeleton and you can handle standing up, sitting down, moving around. That's why we need calcium all the time. Now, Schiff has several calcium products, and we rely primarily on calcium carbonate. Now, calcium carbonate has been the most researched form of calcium, and it spurred the science behind the health claim that calcium intake reduces the risk of developing osteoporosis. So in other words, calcium carbonate is a proven way to support bone health, maintain bone mass, and slow and delay osteoporosis. We use calcium carbonate because it is absorbed. It's well absorbed. It's absorbed as well as calcium from food. And we're talking calcium in milk, and calcium now added to orange juice. It's absorbed equally well. Now what you're trying to do, especially if you're over age 50, and especially if you have a family history of bone loss, is to take in at least 1,000 milligrams of calcium a day, preferably more than that, up to 1,200 or 1,500 milligrams of calcium daily. Now that can be done easily with 2 pills of Schiff Super Calcium. It can be done with 3 pills of Schiff Super Calcium and Magnesium. Now, if you're eating a good diet, you're getting a lot of calcium through your diet, or you're younger and you want to maintain your bone mass, you want to make sure that you're keeping your bones as healthy as possible, then you may not need as much calcium as 1,000 milligrams or more daily. And that's where Shift's calcium-magnesium product comes in. Now, Shift calcium products have added vitamin D to just about every one of them. And we've actually increased the amount of vitamin D in the calcium products, and that's for a very good reason. Calcium is important for maintaining bone health, and if you don't have enough calcium, you have very small chance of maintaining your bone density and preventing bone loss. But there is another nutrient that can really help utilize calcium, make sure that it gets absorbed, and make sure that it gets deposited in your bones where you want it, and that's vitamin D. Shift uses vitamin D3, or cholecalciferol, the natural form of vitamin D, and we have actually increased the amount of vitamin D3 in our calcium bone health products to 800 IUs in some of the Shift products and 400 IUs. Now, 400 IUs is 100% of the daily value. Now, right now, as you hear this, government agencies and organizations are carefully scrutinizing the newer research in vitamin D, and they have put out articles, scientific articles, saying, yes, we need to raise the daily value for vitamin D. So while they're trying to figure out exactly what those numbers are going to be, you can already get what those are going to be in Shift products right now. So we have gone with the science, which says we all need more vitamin D. Now, there's another nutrient that I think is very important for bone health, and that's magnesium. Magnesium is the number 2 mineral in our body after calcium, and it's mostly inside of cells, but really a lot of it is also in your bones. And it turns out that you need magnesium in key parts of your bone to actually help the calcium form its solid, dense, bony matrix. So magnesium is also important for bone health. And yes, if you're deficient in magnesium, all the calcium in the world won't give you your optimal bone density back. You need both. Magnesium is one of those nutrients that's rich in nothing and found everywhere. So you get a little bit out of everything, but that's the problem. You only get a little bit. You have to eat a lot of food to get plenty of magnesium. So really, the best way, again, to get magnesium, like calcium, is via supplements. And Shift adds magnesium to calcium in its calcium-magnesium product and its super calcium-magnesium vitamin D product. So you have your choice of getting calcium with vitamin D or calcium, magnesium, and vitamin D. And you can get 2 different levels of calcium and magnesium. Now, the super calcium magnesium product has one other little benefit to it, and that's boron. This is an ultra trace mineral that actually is playing a role in bone health. It actually interacts with vitamin D on vitamin D receptor sites in cells. I know it's a little technical, but what that means is that boron makes vitamin D work better, which means it makes calcium and magnesium work better. Again, that's been added to the super calcium magnesium product because it does play an important role in bone health as well. It gives you that little extra edge that your bones need to remain healthy. And make sure to look for the Sure Dissolve logo. Products with Shift Sure Dissolve technology are formulated to disintegrate within 1 hour. Well, that wraps up this segment. But hopefully it's just the beginning for you, because when you try out some of these tips, I think it'll be the start of a healthy and strong approach to living. And what's great is none of us have to do this alone. For more information about any of the products I've talked about today, simply use the product search toolbar at the top of this page, because, hey, we can all use a little help. Till next time, I'm Dr. Luke with HealthView. Here's to your health.